Hi, now let's continue our physiological principles of circulatory system. So today we're going to understand the anatomy of the heart and the electrical system that generates coordinated contractions of the heart as a pump. So first, let's thinking about heart anatomy. So to make it easy, we have ways of showing the heart like this. So assume a person is facing towards us, then his or her left side and right side of the heart will look like this. So this is left side of him, and this is right side. So to make the heart as the simplest four chamber diagram is this. So that's basically one right atrium and right ventricle, and this side as a left side for towards this person is a left atrium and left ventricle. The atria or atriums are basically the role is sending the blood to fill the ventricle. So the atrium doesn't need to be very muscular, while this ventricle has to pump the blood. One is throughout the pulmonary system, lungs, and the other left ventricle is pumping throughout our body. So it has to be very muscular. So for that, let's take a look. So right atrium gets the blood from all of the body as a vein called the vena cava, and then that deoxygenated blood will enter into right ventricle, and you have to send it to lungs. So that's going into pulmonary artery. After the lung, the blood gets oxygenated, and that oxygenated blood will enter to the left side of the heart through pulmonary vein and entering into left atrium, and that gets into the left ventricle. And this left ventricle is the main workhorse of our heart. It pushes blood throughout our body via aorta. So 4 chambers composed with the muscular walls is our heart, and it contains right and atrium and right ventricle, left atrium and left ventricle, or atria or ventricles. And it, as you can see, it has 1, 2, 3, 4 inflow and outflow tracts. So that inflow is vena cava, which means it's a vein, and cava comes from Latin hollow vein, and it goes out towards our lungs, which is pulmonary artery, and then oxygenated blood gets towards the heart, which is pulmonary vein. Interestingly, the blood in pulmonary artery, in fact, are deoxygenated. Pulmonary vein, it's a venous blood, but it is oxygenated blood. And then it gets out to throughout the body through this aorta. And now let's consider this left part and right part of the heart. So their roles are a little different. So they basically do drive blood. So the right side of the heart, it drives blood through this pulmonary circulation. The goal is to get the blood oxygenated. And with that oxygenated blood, the left side of the heart does do sending out throughout the whole system. So it's called systemic circulation. So then think about this hardworking heart. So how does the heart muscle, which is continuously working, this also does have to get the nutrients. So there will be a blood to the heart itself while heart is working. So that we call as a coronary artery system. And I'm going to show you over here. So this is a very simplified one, but now I'm getting into more realistic. So the veins are coming from upper side head and upper body, and upper limbs are getting into superior vena cava, and lower body is coming inferior vena cava, giving the venous blood to right atrium, and they get through this valve and then eventually go to pulmonary artery. And the oxygenated blood comes back in through pulmonary vein like this, and they get into left atrium and left ventricle, And through this, there are valves, and then they go to aorta. You look at this interesting shape. So this one goes to upper body, and this aortic arch, this main part goes down towards our organs and lower limbs. And to provide blood for our heart, we have blood vessels on the surface of the heart that we call artery, coronary artery. So you can see this. You see, again, left part of the heart and right part of the heart. So this left part called LCA, or left coronary artery, or right coronary artery. So in the majority of patients who suffer from heart problem, for example, angina pectoris, which is a symptom when the vessels of this coronary artery get thinner due to the growth of atherosclerosis, and that patient sometimes get a lot of pain in their chest. So it's almost like an elephant sitting on top of your chest. And if that become rupture, that part of the vessel ruptures, like denoted here as 1, then it actually causes ischemic issue on the downstream. So you see this part of the heart is partially non-functional, or eventually it dies. Then we call it myocardial infarction, and that can even people get this heart attack and can die. So this rhythmic contraction of the heart, we call it beats. So heart beats are normally like about 60 to 70 beats per minute. Thinking about this is about once per second. I guess our second system may come from this heartbeat from the human.